Now, for the history of stroke, you need to know that what generally you must start with the identification. In the identification, you need to know that there are elements already that can bring out in from the identification and the past history of stroke. Is it clear? From the identification and the past history of stroke, you need to know that you have elements already that are guiding you towards the risk factors of stroke. Is it clear? So when you are in the identification of stroke and the past history of the patient that has stroke, it guides you already toward the risk factors of stroke. Is it clear? Now, before going to the risk factors of stroke, you need to know that what stroke has different mechanisms. Is it clear? So there are different mechanisms of stroke, and depending on the mechanism of stroke, you are going to have a particular risk factor for that mechanism. Is it clear? Stroke mechanism can be ischemic. The first stroke mechanism, a stroke can be ischemic or it can be hemorrhagic. Is it clear? Ischemic or hemorrhagic. So those are the two different stroke that we can have. Is it clear? Now, provided that you have a patient that has an ischemic stroke, it means that what for ischemic stroke, generally the causes is going to be divided into three. The first cause is going to be atherosclerotic. Is it clear? The second cause is going to be the second cause for stroke is also going to be cardioembolic. Is it clear? And then the third cause of stroke is going to be lacunar infarct. Is it clear? So those are the three main causes that we have at the level of ischemic stroke. Now, for hemorrhagic stroke, we need to know that the different causes are: the first cause of hemorrhagic stroke is the rupture of aneurysm. Is it clear? You have rupture of aneurysm. Is it clear? And aneurysms can be from a familiar, it can be genetic. You have grown with that aneurysm, particularly in patients that have polycystic kidney or polycystic ovarian syndrome. Is it clear? They have ruptured aneurysms. Now, the second element, we have arteriovenous malformations, which can also result to hemorrhagic stroke. The third element that can be in hemorrhagic stroke can be cavernomas. Is it clear? Ruptures of the cavernomas. The next element is meningiomas. Is it clear? And then we have hypertension. And then generally you need to know that the hypertension, being a mechanism of hemorrhagic shock, is going to be presented as deep-seated hemorrhage. It means that the hemorrhage is going to be close to the lacunar infarct. It's going to be close to the internal capsule and the thalamus and all those structures. Is it clear? So those are the different elements that you are going to visualize in stroke. Is it clear? So, to visualize stroke, you need to know that you should start up by knowing the identification. So, when you have the identification, basically inside your identification, you can already bring one risk factor. You can bring out the non-modifiable risk factors. Is it clear? Non-modifiable risk factors. You can bring out it in the identification. Now, the second element is that inside your past history, you can bring out modifiables and non-modifiable risk factors. Modifiable and non-modifiable risk factors. Is it clear? And then those are the different elements. Now, let us visualize now the risk factors that you have to bring out. The risk factors now for ischemic stroke. When you have an ischemic stroke, what are the risk factors? Before you go now to the risk factor of ischemic stroke directly, you need to know that ischemic stroke can be atherosclerotic. Is it clear? So you need to know the risk factor first of atherosclerosis. We have traditional risk factors of atherosclerosis, and then we have novel risk factors of atherosclerosis. Is it clear? We have traditional risk factors of atherosclerosis and novel risk factors of atherosclerosis. For the traditional risk factors, it can be divided into modifiable, and